Hello, I am Janet Cantor. I'm the training manager here at Community Health Center Network. I'd like to introduce you to Eugene Canson, who's our Health Policy Analyst at the Alameda Health Consortium. And we're going to spend a few minutes to talk about public charge, its relationship to toxic stress, and the impact that public charge has on our patient community and health centers. So Eugene, will you tell us what public charge means?
Yeah, definitely. So public charge is a term used in immigration law that describes someone who is likely to become or has become primarily dependent on the government as their main source of support. So currently, if the government determines that someone is likely to be considered a public charge, they can deny that person admissions into the United States or their lawful permanent resident status, also known as green card status. And so the current rules on the current rule and regulation, what can be considered in public charge determinations are cash assistance, such as supplemental security income, SSI, or temporary assistance for needy families, TANF, or long-term institutional care paid for by the government. So however, on October 10, the Department of Homeland Security published a proposed rule that would extend those benefits to include non-emergency Medicaid or Medi-Cal, the Supplemental Nutrition Assistance Program, or CalFresh here in California, as well as Medicare Part D, the low-income subsidy program, and housing assistance such as Section 8 vouchers as well.
So when you say extend that program, you mean they made more things included on what's considered public charge and therefore be government assistance for these immigrant populations?
That is correct.
Okay, thank you. So we've been hearing a lot about toxic stress among our immigrant populations at our health centers. And can you tell us how toxic stress and public charge is related to each other?
Yeah, definitely. So, immigration policies such as this public charge proposal often leads to anxiety and fear and toxic stress amongst our immigrant populations. And so this public charge proposal adds on and adds to this climate of confusion and anxiety that our immigrant populations are facing, and it's preventing them from enrolling into critical programs such as Medi-Cal and CalFresh that is important for their health and well-being.
And so can you tell us a little bit more about the impact on our patient populations and their communities and the health centers with public charge expanding into Medi-Cal?
Yeah, definitely. So this definitely has a negative impact on our patient population as well as our community health centers. And so we're already seeing right now, before the rule has been finalized, that we're seeing eligible immigrants disenroll or not enroll into public programs such as Medi-Cal and CalFresh, in fear that if they enroll into these programs, it would jeopardize their immigration status. And with such disenrollments and the lack of enrollment, that likely will lead to negative health outcomes, as well as increase in costs of unsubsidized care, as well as a loss of revenue to our community health centers that provide these necessary programs.
And that revenue is important to keep the doors open.
Most definitely.
Yeah. And lastly, we just want to know, what can we do to support our communities and the health centers during this time?
Yeah, so I encourage you and everyone else and whoever's watching to go out and comment in the Federal Register against this proposal. So there are several organizations who are working hard to provide resources and template comment letters to the community organizations such as the Protecting Immigrant Families campaign, Asian Health Services One Nation campaign, as well as us here at the Alameda Health Consortium. So I encourage you all to comment. The deadline is December 10. We're hoping to get as many comments as possible because the government has to respond to all the comments. So we're hoping to get as many comments as possible, and December 10 is that deadline.
And will you send us either a link or how to access that Federal Register?
Yes, there's a comment portal that the consortium has, and we'll send that out. Great. As well as different resources to help you understand the proposal in its entirety.
Thank you so much for telling us more about public charge and the impact that it's having on the communities that our health centers serve. It sounds like there's a lot of work for us to do.
Thank you for having me.